children of all ages and social class. Mental illness does not discriminate. Faced with the tough reality of societal stigma and discrimination, 13-year-old Julius from Jinja district, Buwenge sub-county, had to endure his peers and community's negative attitudes and perceptions towards himself and other people affected by mental illness.
This illness started.
I was in class studying and suddenly I felt unconscious. After receiving treatment, I started getting better. My parents took me back to school, but the school administration rejected me. We finally got another school where I was interviewed and I passed. It is where I am schooling now. Majority have been forced to believe that mental illness is a punishment from the gods, and those affected are treated as outcasts. As such, the sufferers are forced to seek help from the traditional healers and sorcerers.
Natukitsera nakuba omukazi nti oba omwana afwe ayidu sente abayigade bali tuliya kudawelere nga buli tumutwala gabitawo kabiri na kuntono chairamu tumutwala chaira
era nebaza okusookera yala nebaza omusawo yasooka okundagirira ebudima musawo kyakulaga gwe nayagana ina mwendo health center tu mfunye wendawulo ya amaani kuba buti we bali kuidagala ezira kizibu kyenkafu nakyo nakyona.
Julius's story is one among the millions of Ugandans affected by mental, neurological, and substance use disorders.
All researchers in low-income countries indicate that about 80% of the population of people with mental health conditions do not access treatment.
Given the magnitude of the treatment gap, World Health Organization launched the Mental Health Gap Action Program, mhGAP, in 2008.
It's a program that was developed for low and middle income countries after realizing that the burden of mental health was increasing, and yet there were not enough specialists, qualified psychiatrists, to handle all those cases.
The need for intervention in Uganda's mental health situation compelled Ministry of Health, in partnership with World Vision, to embark on a pilot project to scale up access to mental health services in Jinja, Kamuli, and Kitgum districts in 2012.
So we thought the best way is to integrate it in primary care and increase access by this 80% of the population.
In order to achieve the project goal, numerous interventions were undertaken, including training of health workers of all cadres and all levels of the primary health care, village health teams, district health management teams, other district stakeholders like police, political, religious, and local leaders, among others.
Most importantly, are they able now to recognize that this person may not be having just malaria, but may be having a mental health conditions, and therefore be able to appropriately refer these people for care.
We were trained, managed to understand how to assess a person with a mental health problem, and we could categorize that we had mainly mental, neurological, and substance use disorders.
Kinyambye nti nkendezeza abaana ab'embeera ngezo mu kitundu. Ekyokubiri tugezezaako gwengambe enkola yange ne poliisi kituyambye okukendeza enjaga mu bitundu.
Information, education and communication materials were also developed to supplement knowledge acquired by the populace. Interpersonal psychotherapy for groups has also been very instrumental in restoring hope in the lives of men, women, and children.
Ya grupo konya mena tam ni mera babeta pa mera kachar luar ni to ne wayap to kachel wakegi kubera no rangat te mabar.
Ya do maber katamo kwe ka mera ngama mera konya an kere. Tameka welo tiana ni mana tim kini ni kiaron ko tergia chama pinonge
Florence was then identified and, with her consent, recruited into one of the interpersonal psychotherapy groups for women in her village. This has played an integral part in giving such women as Florence hope. Likewise, users of MNS services were also supported in Jinja and Kamuli to form peer support groups to enhance their recovery process. Users of MNS services have now formed music, dance and drama groups to educate communities through their testimonies about mental, neurological and substance use disorders.
Anti bali batusosola ino nga era olukubona nga kati omuntu abufuyo nga benda akuba buti batandise okuvaayo bati bakatusosola ino baidi nti it is a disease for all eringa malaria.
Radio talk shows have played a big role in educating and sensitizing the masses.
Many patients were stigmatized and could fear to come and talk to anyone that they have a problem. But after this program, we realized that people and patients became free.
So we would like to see this project rolled out so that other people can also benefit from this kind of intervention, integrating mental health with other services.
That way, the well-being of girls, boys, women and men affected by these disorders will be improved, thus enabling them to live relatively normal lives and making a contribution towards national development as dignified citizens.